Are you working on health goals for the new year? Well, something to think about is intermittent fasting. It is a trend that's been popping up lately, and our guest tonight is a big fan. Joining me right now to talk more about it, this is Dr. Luiza Petre, and she is a New York cardiologist and nutrition expert and associated with Mount Sinai. Dr. Luiza, it's so good to have you here tonight.
I'm so glad to be here, and it's just the right timing. We're right before New Year's resolutions.
I know,
right?
and a lot of people are eating. I'm a grazer. We were talking about this before we went on the air, but that's not a good thing. You say that this intermittent fasting is the way to go. Okay, tell us exactly what it is.
Intermittent fasting is fascinating. It's not a new concept. It's been around for centuries, from cave time. We didn't have food all the time. We just ate when we could hunt something, right?
Right.
And later we started practicing it for religious reasons. So basically now we are rebranding fasting as intermittent fasting just because we have more science to back it up.
Right, so it's more popular now, okay? Now you say the key here is not what you eat, it is when you eat. Tell me how I would schedule that, because I want to learn from this. How do we do it?
Correct. So there are many ways to practice intermittent fasting, but the one that I find easiest and I recommend to my patients and I do myself is the 8 to 16 hours method. So basically it's a daily pattern of eating and non-eating. You put all your meals together within an 8-hour window and you fast for the rest 16 hours.
Oh, so the 16 hours is really important there, right?
That's actually the key, and that brings most benefits of fasting.
So what does it do? It gets rid of all the toxins and so forth in your body during that 16 hours?
When you fast for 16 hours, your body actually turns to use fat as a source of energy, and body starts regenerating, gets rid of debris, and it's like a detox phase.
So 3 meals a day and 2 snacks, and you limit it to that.
Well, that concept it's overrated and it's a little bit outdated. We are taught kind of the wrong thing. It's better to eat in smaller amounts in a smaller window.
Okay.
So when you eat 3 meals a day and have 2 extra snacks, you kind of become a grazer. When you graze, your body is always in fat storing mode versus fat burning.
Okay, so we have to change that pattern there. Is it for everybody? I mean, should you check with a doctor or anybody? Do you need to do that in case?
Well, first of all, intermittent fasting is not a diet, it's a pattern of eating, but however, it's not for everyone, not for pregnant women, for diabetics, or for frail people. If you have any questions, you should discuss with your medical provider.
Right. Always a smart thing to do. Dr. Luiza Petre, I thank you very much. It's working for you. I think I'm going to give that a try, okay? Because I am a grazer, and now I'm going to try the IF project, okay?
Let me know. I'm looking forward.
Okay, thanks so much, and good holidays to you, too, and a Happy New Year.
Happy holidays
and a healthy
to you,
one.
too.
Thanks so much.